cell count is in the normal range, I want to call your attention to the next levels here. RBC, hemoglobin, hematocrit. These are super important because remember I talked earlier about how your red blood cell count, this is what carries oxygen in your blood. Everything that you perceive about energy is nothing more than oxygen in your blood. If you told me, Gary, I had a lot of energy today, physiologically what you're saying is I had a lot of oxygen in my blood today. So if oxygen equals energy, which it does, if I'm going to raise your energy level, I need to raise your oxygen level. How do I do that? I improve the amount of red blood cells in the bloodstream, and I improve the amount of hemoglobin in the bloodstream. How do you do that? You restore testosterone levels to normal, and that will increase the production of red blood cells. I have hardly seen, I don't know if I could say I've never seen it, but very rarely have I seen a client that had very low levels of testosterone, clinically low levels of testosterone that did not have clinically low levels of red blood cell, and also complained of fatigue, exhaustion, poor short-term memory, poor focus and concentration. If you want the latest research, Google American Journal of Urology, which is considered the Bible for male endocrine therapy. Just put into the Google search engine, American Journal of Urology space testosterone. Scroll down to section 13, and it will say clinical guidelines for testosterone therapy. Read from 13 to 21. You will be sold on male hormone therapy. They dispel all the myths in this journal. It's a peer-reviewed clinical journal. All the research is cited there. Don't take my word for it. That low testosterone is a risk factor for cardiovascular disease, not the other way around. Testosterone does not increase your risk or hormone therapy does not increase your risk of cardiovascular disease. Hormone therapy does not increase your risk of developing prostate cancer or exacerbating prostate cancer. It can improve erectile dysfunction, anemia, bone mineral loss, mood. All of that research is right in there between sections 13 and 21. Journal of American Urology, space testosterone. That's one of the most revered journals in the world, which is why I send people there. If you're a physician and you disagree with that, go to that journal and all the research is cited. So you want your red blood cell count to be in the upper end of the normal range. And then you want to keep an eye on hemoglobin, which is the fluid in the red blood cell. You want that towards the upper end of the range. And you keep an eye on something called hematocrit. Hematocrit is a measure of your blood's viscosity. It tells me how close is your blood to water or how close is your blood to motor oil. As your hematocrit rises, your blood is thickening. Easiest way to reduce the viscosity of the blood without blood thinners is to do regular blood donations. We call it therapeutic phlebotomy. If you are taking testosterone therapy, your doctor should probably be recommending that you do regular blood donations. This for men is very healthy. Right? If you look at the incidence of cardiovascular disease between men and women, you'll see that men lead women by a huge margin until women stop menstruating. Then there's a parabolic hockey stick spike and they begin to approximate men in the incidence of cardiovascular disease. Why is that? Because they stop turning their blood over, right? So doing regular blood donations for men is very healthy, unless you have something going on.
I'm not doing that. Does it show that I'm not doing that? I should be doing that.
Yes.
What is it? What is regular?
Every 3 to 6 months.
Okay.
Yeah, your hematocrit is 50.2, which is considered pretty thick. At 51, you're 0.8 of a point away from being having clinically thick blood.
Okay.
Right, so being clinically out of the range. What you will notice, you feel better right away.
Okay.
Lots of clinics will also, if you're one of those people that gets lightheaded from donating blood, you're not getting lightheaded from the loss of blood. You're getting lightheaded from the loss of pressure because the amount of pressure in the system is fixed. So if I pull a pint of fluid out, the pressure drops, you get lightheaded. So the way to solve that is to talk to your doctor about running an IV, put 500 milliliters of just thin, clean fluid in, then put the bag below the level of the heart, pull 480 to 500 milliliters of thick, old, tired blood out. The pressure will remain the same.
Okay.
The viscosity will change. So I see our clinical team do that a lot.